My name is Alicia Carlino, and this is my final presentation on the Wind Bowl battle. My topic of interest was smoking. So just an overview of the battle. Smoking continues to be the largest preventable cause of disease and premature death in America. Worldwide, tobacco can cause more than 7 million deaths per year. If the pattern of smoking all over the globe doesn't change, more than 8 million people a year will die from diseases related to tobacco use by 2030. Only 2.4% revenue from tobacco taxes and settlements are used on programs to prevent smoking in teenagers. The FDA takes that number from each state and sets a regulation of what they think each state should be using to put back into the smoking efforts. But most states fall under 20% in giving to programs to stop smoking, and 3 states give nothing at all. Those are Connecticut, West Virginia, and Tennessee. So just a brief history. Smoking has been around since the 16th century when tobacco was used as trade. We saw a boom after the industrialization. In America alone, 4,500 people are admitted into the hospital every day from a smoking-related disease. 17% of American population smoke. 1 in 6 deaths over the age of 35 can be caused by smoking. And more than 50% of people have been exposed to secondhand smoke. So some social determinants that I think are important are gender, race and ethnicity, income level, educational attainment, geographic location, disability, and age. As we can see, this is a large range of social, environmental, psychological, and genetic factors that all have been associated with tobacco use. Right here is a picture from the CDC, which I think is important because it highlights how older adults 25 to 64 have a higher chance of smoking. I think this plays a lot into smoking nowadays just because of the generational gap and how we are, and you can see down there where there's a run mass of media campaigns. And I just think nowadays it's easier for people to know the outcomes, whereas back then maybe it was just a normal thing for them to be smoking. All right, some positive determinants that I think are really important is that stores such as Walgreens have increased their age that they sell tobacco to people from 18 to 21 starting this September. Also, I think it's important that Medicare and Medicaid now are able to provide smoking cessation such as Chantix, the patches, and the gum to patients who want to stop, whereas beforehand, I think 2 years ago, it was not written in there that they would cover that, so most people would have to get prior authorizations or would have to pay out of pocket for those drugs. So for the best practices, I chose American Lung Association. I chose this one because it has a personal relationship to it, and I just love how they not only advocate for tobacco use and tobacco-related diseases to be stopped, but also just to improve the air, and they do a lot of research into it, not only to defeat it, but just to know what's happening. So on the screen is their mission statement, which is great. But to summarize it up, the best practices that they think is 1, having the FDA have oversight for all tobacco products. As we learned earlier, they're already setting regulations. They are the ones who encourage Walgreens to increase the age, and they're the ones who set that example of what they think each state should be putting back into it. So I think that'd be a great thing. The second is they require medications for cessation of smoking to be covered across all insurances, not only government-given insurances. And the third is they want the Tobacco 21 law to be across the United States and each workplace to require it to be smoke-free, the way there's no opportunity for smoking. And lastly, they want to increase tobacco taxes. That way people will hopefully not smoke as much. So for questions, over the years, younger adults are smoking less, but adults are more. What do you think can be done to help overcome the generational gap in smoking to decrease the amount of diseases related to tobacco? And second, the rise of electronic cigarettes have increased the amount of young adults smoking. What is something that we can do to combat that?